My patient was undocumented, but she was a mom of 3. And so she feared that, how is she gonna go with treatment? Thankfully, with the Breast and Cervical Health Program, we were able to connect her to our treatment program coordinator at the time.
And I felt very strongly that this patient really needed imaging. The patient was a little hesitant, asking how much was that gonna cost? Is it gonna be $100, $200, $300? And that's sometimes the difference of whether they will actually get that ultrasound or that imaging study right away, or many months down the road when they feel like they can afford it. And months we don't always have, right? That makes a huge difference in someone's diagnosis and someone's prognosis, to be able to kind of catch things early. That's the whole point of screening, right? Is to catch things early. And it was really nice to be able to say, we can use this BCCHP program to actually get you screened, have it be covered, so you can get all this imaging without having to worry about the financial implications or cost to your family.
And I'll never forget this patient because she went through, she did receive treatment. And after about a year or so, she went into remission. It's hard to find people that kind of understand where you're coming from. I shared with the patient that, as a daughter of immigrants, of Mexican immigrant parents, it was these type of programs that helped my mom complete her screening, her screenings that were needing to be completed. And I think building that connection, letting them know, hey, we are here, really meant something to her. It's a lot to take in, and especially when you can feel not supported and maybe not even in your place, like out of place in this country. That really hit home for me as a daughter, as a mom, right?
The Breast and Cervical Health Program helps us live the mission by providing access to breast and cervical health screening services, provides also access to breast cancer and cervical cancer treatments. I think that the Breast and Cervical Health Program is a huge example of collaboration across our organization, really. It really starts from our team to the front desk, handing those enrollments out. And then on the back end, the MAs creating those diagnostic or ultrasound orders. And then sometimes our referral coordinators sending those referrals to the contracted facilities, and also messaging the providers, getting clarification on certain diagnoses, and really making sure that our patient is taken care of.
And even after our monthly Mammovan Day is completed and our patients have completed their screenings, there's still cooperation and work that happens with that. So, the Swedish team is sending those results back to our clinic. The medical records team is helping to process those and get those where they need to go. And then the providers and MAs are reviewing those records. And then Jenny, the Pensy, and I provide support with any high-risk tracking as needed. So as folks know, breast cancer screening is always something really important to us as part of primary care. And in 2023, we're putting particular focus on it because it's one of our priority measures for the year. And so as a QIC, that's something I'm really paying attention to. And the amazing thing about the BCCHP program is that it provides funding for breast cancer screening for people who otherwise might not have insurance coverage or otherwise be able to afford this really important preventive service. And so because of BCCHP, there are patients who are able to get breast cancer screening, which one is critical to their own health, and two, also will help support our measure to promote that screening among our patients. BCCHP is even a part of one of the quality improvement PDSAs that we're doing to increase breast cancer screening rates here at Auburn.
Thinking about the financial aspect of it, I think it helps HealthPoint provide services to other patients. So, we receive reimbursement for those services through, King County, the BCCHP program. but we're able to kind of pay that forward in other areas of our organization, and I think that's really important and essentially really does help us expand care and provide care to everybody.
I wish more people knew of the program. I wish that they knew that yes, there is obviously certain criteria that needs to be met in order to be enrolled. But even if the patient is insured, right? Even if they have insurance, is their deductible high, right? We offer support and we help the patient enroll even if they have insurance.
If you have a patient in front of you that you think would benefit from this program, or that you know is maybe overdue for services and they're hesitant, or they are maybe worried about not being able to pay, reach out to us. We are always available to answer any questions, to talk one-on-one with the patient, to really just kind of guide them through and help them.
And sometimes we can get caught in the moment and kind of miss the bigger picture, right? We get so stuck on our routines daily that sometimes, you know, when these things happen, it really shakes you to your core and makes you realize, like, wow, you know what? I'm really doing a difference and I'm serving my community. It's very fulfilling to know that my team, the organization that I work for, is also on the same mission, right? Patients at the top and trying to provide them the best care that we can.